evaluation. That was very much our focus, was to concentrate on the process evaluation, which is looking at implementation and how are things working and what could go better, what went well. We also then focused on short-term outcomes. The scale of our project was not such that we would expect a population level effect, and the timing was relatively short. So we concentrated on, if you remember CDC's logic model, we concentrated on measuring whether or not those short-term outcomes were met. You know, did CHW knowledge and comfort with material, especially COVID-related material, increase, for example?
Thank you, Chris. So just one more from me to you. So I know that your evaluation questions lead to choosing specific data collection methods. Can you talk to us about the methods that you chose to use to connect into your questions or answer your questions?
It's such a great question, and it's I'm trying to think about how to. I think the best way to answer in a short amount of time, unless all of you have more questions about this, is to think of it at a high level. I immediately want to go into the weeds, right? But essentially, we're thinking about, per every evaluation question, what are the constructs or measures that we need? For example, I mentioned training, right? And as related to training, we wanted to be able to measure, did we really increase CHW knowledge and comfort with the material? Did we increase the amount of conversations they were having about COVID? So we went from the evaluation question to thinking about what constructs we need, and then do we need to collect data on our own primary data collection, or is there some existing source we could use? And then I think the last factor is practicality, right? That was it. Honestly, that's part of how we decided how to collect data, was what is practical. So for example, we heard from our advisory group that CHWs would do a survey if it was all close-ended questions, but if we have these large open-ended questions, they wanted those in a listening session or focus group. They said, don't put those on a survey, we'll drop it.
Thank you, Chris. So Joyce, as a CHW leader in King County and as a part of this project, because I've been lucky enough to work with you in the past and I know this, talk to me about how you and CHWs were part of shaping the survey questions that Chris was talking about.
Yeah, thank you, Kathy. The CHWs were brought in, of course, at the table to be able to help develop the survey. So helping to design and develop the survey. The CHWs were brought in also to help not only just develop, but to spread the word of the survey. So spreading the survey out to organizations that had community health workers in the community, so that they could spread the word about the survey, so we could have as many CHWs as possible take this survey. CHWs were able to, we had them test the survey so that it could be critiqued. Wanted to make sure that, for example, the literacy was there, and making sure that we included all CHWs. So helping to spread the word. The CHWs helped in that, to test the survey, develop the survey. Let me see. Of course, wanted to make sure in all that that they were able to tell us how well the survey was developed and how well it was working.
So, Joyce, I know that at least for me, sometimes I'm really just tired of the amount of things that come to me that I have to do. What did you do to actually encourage CHWs to take the survey, to spend the time and effort to answer all your questions?
Yeah, I mean, I would say probably the number one was the compensation, but I would actually also add to the fact that it was about them as well. It was about what was important to them and hearing their voice and them being a part of it, and getting their feedback. It's like, oh, you really want my voice to be able to develop this data collection information, which was very, very important. And then two, also, we compensated them. So we compensated CHWs $50 to take the survey. And then organizations, we compensated $100 to complete the survey. But, like I said, I think both of those go together and show the importance of having CHWs be a part of a development and being at the table from the beginning.
So if I build off of what we talked about last week, really it's having CHWs involved from the very beginning so that you know that what you're asking is actually meaningful to them. And then I know last time we talked about paying people so that you're valuing them, and both for you valuing the CHWs and the organizations that they work with. Anything else that we should keep top of mind?
Well, I think I shared kind of some of the very important pieces, but I think it's worth sharing again is, having the CHWs at the table from the beginning of the development, what's needed, what works, what doesn't work, making sure that we are including CHWs from all cultures and, communities, and as much as possible, to have I want to say, not really say, but to share their thoughts, their opinions, what's working, because they're doing the work. So they're out there. They're the ones doing the work. They know what the community needs, or the clients that they're serving needs. And so being able to bring those expertise to the table to help develop and collect data, I think is really important.
Thank you so much. Now, I know that I always have a picture around how things are going to work before I start, but it just never ends up that way. Orlando, can you bring up the slides again? And we're on slide 11. And Chris, can you talk a little bit about the challenges that you faced and how you had to adjust your methods or expectations?
Sure. Yes. And this is where folks ask questions if you'd like to know more. Joyce mentioned we initially tried to last fall survey community-based organizations and offer a $100 incentive. And we primarily hope to distribute that through a healthcare network. So one of our partners shared the survey link on social media, which resulted in a number of fake surveys. And I've had the good luck, perhaps, of running into this. This is my second time running into this. So I only know how to sort them out and find them by hand. But just to give you an example, I think we got 203 surveys back. And after significant data cleaning, we had 19 surveys that were valid King County organizations that employed CHWs. So we're not going to do that again. And we didn't get the organizations that we were hoping to get. It was primarily community-based organizations and not enough healthcare organizations. So we're looking in the next year to replace the survey with focus groups and interviews. And then of our immediate partners, when they send in invoices, we ask them to share information in a narrative report. We're also going to use that. So that's one way, and we will use incentives. The survey of community health workers, the first time around we did it, I confess I was worried about money, so I did a raffle. We did a raffle to offer incentives, and we have now moved from a raffle to giving every individual an incentive, because now we have less worries about that. And then, as Joyce mentioned, we have multiple pathways to disseminate, including our partners. And I think we went from Our first survey had a count of 39, and this last one, the last time I checked, the count is at 87. So Joyce and others really helped us out. And then this is more in the future, but I'm hoping that we all have some time to talk about it. And Noelle's been a great support for us. We hope to, in the last year of the study, survey community members and ask CHWs to collect that information because they have the relationship. And in King County, distrust of government is an issue. So we're hoping to implement that, and we've thought about how to do it. We're hoping to keep it very, very short. We want to offer a training and then record it and make it available on a website for the project that we're hosting. We'll also have scripts available if people want to know what to say, and we'll translate those into many languages. And then we'll hold office hours, right? If people want some support while they're collecting the information in that week or two. So those are a few things that happened. There's many more.
It never just quite goes the way you imagined. So Leo, I think we have some questions from the audience.
Yes, we do. Thank you so much. So first comment, Sarah says, great chart. And Gretchen asks, Chris, was there a warm touch before sending the survey? How did you decide who to send to?
Good question. So this is where program and evaluation partnered well. You know, Jan Capps and others put together a list. And as we have offered trainings, we've been building a list of CHWs. And so we have a list that we can initially share the survey with. I'm very fortunate to have worked the COVID response in a program way. And so I reached out to CHWs that I had worked with during the pandemic. Joyce reached out to all of her connections. And then we have CHWs in the asthma program who reached out to who they knew. And then we asked our partners to widely distribute. And I think one of our partners put the most recent survey link in their newsletter. And then please know too, as part of the introduction, I should have added this last most recent survey, we are asking them to sign up for a 1-year study, which will have 3 surveys. And this last one is the first survey. So we are hoping that being realistic about here's what we're looking for over the next year, and we'll give you $50 a survey, right? I'm hoping that the added transparency helps us a bit.
Okay, going once, going twice. Any more audience questions for Chris or Joyce?
Gretchen says, that's a great partnership. Thank you for answering my question. Was brainstorming on how to increase hospital centers.
Thank you. So you won't be surprised to hear that we are going to go into breakout rooms and talk about how we are consultants to one another in really thinking about how do we monitor and adjust for the challenges that come up in our data collection activities. When we move into your groups, please take a moment and assign or have somebody volunteer to be a facilitator, a recorder, a reporter, and a timekeeper. And we are going to have a Jamboard in each room. Chris, is this the time to demonstrate that? What the Jamboard looks like before Joyce does the questions?
We could. Do you mind, Orlando, putting it on the screen?
Sure, right now. Give me 1 second.
So this should, we added this in hopes that it makes recording a little bit easier for us all and also gives us all a reference as we try and solve this issue. So the Jamboard, I think someone added a link in the chat, and what you want to do if you've not used this before, there's 1 slide per, so let's start with the sticky note. So the 4th icon down where Orlando is a sticky note. And if you click that, the sticky note comes up, and then you can go there and type in, right? And what we were thinking is you could type in what your challenge is and then ideas for addressing the challenge. Or you could answer the second question, right? How can we best collect input from community members? And then you just save it and it's there. What we created so that you have enough room, we created one slide per group. So Orlando, if you go to the top, yeah, so if you hit that arrow, you can go and find the group that you're in. And that will just ensure that you have enough space.
Okay, thank you, Chris. Joyce, what are people going to be doing in their breakout rooms?
Thank you. So as you shared, we'll be going into small breakout groups. And in those breakout groups, we are asking folks to have discussions around 3 questions. Question number 1 is, what data collection or other evaluation challenges are you facing? What ideas does the group have to meet this challenge? Sorry, my dog is wanting to talk too. And what strategies are best for collecting input from the communities? If you have time, you could address all 3 questions. If you can't, we're hoping that you can. If not, at least, get 1 or 2. And then post your challenges and ideas on the Jamboard. And then we're going to come back into a large group and ask someone from each one of the groups to kind of share out. Hopefully we'll get to all. And we'll ask someone from your group to share out in the larger group. So these are the 3 questions. Should we post them in the chat so that you guys have them, or is this good that you see them here?
Yeah, Joyce, I want to make sure I understand. So as we come into the group, if there's somebody that's really got a data collection or other evaluation challenge, share it. And then, because we're all teachers and learners, we'll help think about possibly ways to address that. If there's not a specific challenge that you're really wanting to work on, the questions around what strategies do you use that are really great for getting input.
Yes.
Right. So
that's right.
Okay. So that's right. And then we'll have probably 20 minutes.
20 minutes. Yes. So we'll have 20 minutes in each small group. And so,
perfect.
Yeah.
And the questions are on the Jamboard, right? Yep. Okay.
They are? Okay, good.
Perfect.
So,
okay.
Yes, using our time
for a great talk
strategically.
show. And Lauren, take it away.
Give me 1 second. Sorry, a few people left right as I was about to open the rooms, and now we're off balance. Thank you for your patience.
Okay. Welcome back. Do we have a brave group who's willing to jump in first and share some high points from your discussion and maybe your Jamboard? Sarah.
Okay, hi everyone. So a couple of things from our Jamboard. So some challenges that we actually both of our groups experienced were like overwhelming number of tools required to report. So as you know, there are a bunch of performance measures and trying to keep track of everything, specifically the CHWs keeping track of everything. And then once the CHWs submit, there's no access to edit. And sometimes the reporting reporting templates can be really long, and it's kind of clunky. So those were our challenges. And then some of our strategies to address it were maybe TA or office hours with CHW input on Google Sheets with both the CHW and the eval and the evaluator, as well as kind of looking forward in the future to include other languages other than English for our CHW input form. Thank you.
Thank you, Sarah. Other groups, jump on in as we're all teachers and learners and can learn from one another. Kelly, can I ask you to summarize what's on the Jamboard from our group?
Sure. So we had a big discussion about the challenge of reaching the CHWs that you want to reach, who really have the most input with the community, and how to get survey responses. So we did talk about how it, if you're going to look at surveys as your method of data collection, that direct compensation helps, and actually money versus t-shirts or other types of compensation are the most effective. And then also a little bit about looking at doing listening sessions or interviews as a way to get data. If you know some CHWs who are specifically who you're wanting to reach, then maybe instead of having them do a survey, working with them in a meeting and scheduling time to hear from them directly. Also talked about using a couple of different modalities to collect information, because sometimes different people respond to different kinds of data requests. So maybe using a mobile app, if that's available to you, maybe using a survey, maybe meetings, maybe interviews, and things like that. Social media, just people's experiences in our group echoed what we talked about in this session, that social media hasn't always worked to get the right people to answer the survey, because a lot of people may see it and answer the survey without having input or even being a CHW. So
Kelly, one of the things that I learned was about payment to CHWs and how people want to get the payment and how much information they need to share to be able to get that.
yes.
And having a variety of ways, whether it's sending it to their institution or Venmoing, but really facilitating, enabling the CHW to say how they want to get the payment, I thought is something I'd never really thought about.
Thanks for mentioning that. I don't think I got that on the Jamboard, so
That's okay. We all get different things. Other
I may go
groups,
ahead and
things you
add
want
it
to
'cause it
share?
looks like it's still up.
Yeah, I'll hop in. So our group spent a large amount of time just really highlighting the difficulties in data collection, and reason being that organizations tend to use their own mechanism for doing so. Some larger scaled, like clinical type organizations, will use more of their EHR platforms, whereas some smaller CBOs may use Excel information, and trying to then develop those platforms to get the centralized information can be a challenge. Also running into like the EHR system, which is something that I can speak from my end. So I'm a community health worker, and working with moving our Excel sheets to our EHR platform, we've had difficulties making that work in terms of the separation of billable and non-billable services, as community health worker activities aren't billable just yet in the state of Pennsylvania, as we work towards that. So making sure that the data is separated appropriately while asking for the correct the data we're looking for. So some of the solutions that we've talked about or suggested strategies would be to, the beginning part, to take inventory of the databases that each partner is using, and then developing their database to fit the messaging that they're looking to collect. But really just highlighting the differences between partners and what they define as like a touch point, for example, encounters, things of that nature, to ensure that it's clear and concise and uniform for the appropriate data capturing.
Really requires you to be nimble. Other thoughts, challenges, things other groups would like to share? Going once? Going twice? Okay, Lauren.
All right, wonderful. So we're going to move on to announcements for the upcoming session. That'll be next month on May 23rd. In that meeting, we'll look at more steps in the cycle of equitable participatory evaluation with a focus on data analysis and interpretation. So if your team has expertise or interest in those areas and would like to be involved in the co-facilitation and co-planning of session 4, please email me and I will stick my email in the chat. But we'd really like to work with any and all of you, so don't hesitate to reach out. Does anyone have any questions or comments on today's session or the upcoming session? Alrighty, well then I will pass it over to Leo to close us out with the evaluation.
Thank you all for participating and for your grace and patience. For this bit, I would like to ask you a couple of questions just so we can gain your feedback and understanding of the material. So I'll ask 3 questions and I'll give 2 to 3 minutes per question. And we invite you to unmute and share with us the answers to each of these questions, or you can also share them in the chat and I'll be monitoring the chat too. So first question is, what did you find useful about this session? I didn't get it. Thanks for the notes of the Jamboard.
Hello, the Kansas Department of Health and Environment and the Center for Disease Control and Prevention are conducting a survey about CoP. For many people, the survey will be very brief. If you have any questions, you may contact us toll free at 1-866-445-31.
Luis in the chat says talking with other 2109 recipient in the breakout room. That's awesome. I'm wondering what the rest of the team thinks about that kind of interaction. Any examples of what you liked about those kinds of discussions? Yes, agreed with Luis. Sarah says, I liked hearing what others are doing and how they specifically address challenges. I loved the talk show, Noel says. Okay, so feel free to answer and I'll be monitoring the chat. I'll be capturing all this information. Your feedback is valuable to me, so I'll be transitioning to the next question. Oh, Sarah says, I love hearing what others are doing too, also getting outside perspective. Thank you so much, Sarah. Next question is, how can we improve for the next session? We invite you to add it in the chat or to come off mute. Thanks, Noel, for putting the question in the chat. I'm also going to put the questions in the chat just in case. I'll put the last question too. Anything in particular that we should use more that works for this type of evaluation, maybe that we can enhance further? Rosa Medrano says, I like that Jamboard was used for discussion, so it allowed us to see what other groups discussed as well. Thank you so much, Rosa. I'm wondering what the rest of the group feels, how they feel. Oh, we get lots of likes. I invite you to unmute. Maybe give us some examples of what in particular you liked about the Jamboard.
I can share for the Jamboard. I liked, yeah, that to Rosa's point, we can see what other groups discussed, and for like note taking, it's easy to take just a screenshot. So if you're taking notes, you don't have to like type to try to get everything people are saying. And also just for reporting out, makes it kind of easier to remember what you discussed in your own group, or to share reporting and recording responsibilities.
Thank you so much. It sounds like it's kind of easier to harness that information then, because it's in text format, it's in visual format. Thanks, Sarah. That was insightful. Jill says, I like Jamboard too. It helped split the recording amongst the whole group instead of putting it all in one person. Oh, yeah. Thank you for that. So I'm also going to put this question. This is the last question. I'm going to put it in the chat for folks who like to leverage the chat. And we also invite you to come off mute. So answer yes or no. This community of practice has been applicable to my work on the CCR initiative. We invite you to answer both in the chat or come off mute. And if you want, provide, or if you care to provide an example or give us why. It'd be really nice to know. Chris says, yes, has been applicable, gives me ideas for implementation. So glad it was helpful for you, Chris. Thank you so much. Sarah says, yes, got ideas from the presentation and suggestions from the breakout room. I'm glad that that was helpful. It seems like a lot of people are really liking the breakout rooms. What do y'all think? Well, it seems like my time is up. We invite you to reach out to us via email in case you have, you're sitting and thinking about our session and maybe you have something that you wanted to say, maybe comes to mind, feel free to shoot us an email. I'm putting my email in the chat. Oh, Wendy says breakouts are great because it facilitates more engagement for us participants. I'm so glad that that was helpful that way. Thank you so much. So I'm sharing my email and inviting you all just to drop by and give me some feedback, and we promise to integrate your feedback and really make it count for all of y'all. So thank you. And that was it for me. I appreciate you all. Oh, Sarah says breakout rooms. We don't really have other opportunities to learn from other grantees and small groups, so it's valuable. Wow, thank you so much for that insight. Anyway, thank you all.
So thanks so much, everyone. Orlando, I think maybe we could bring the slides down at this point and just thank everyone for your participation. And we'll a special thank you to our partners, Joyce and Chris from Seattle King County. And we will look forward to seeing you all next month.
Thank you. Bye-bye.
Thank you all. Take care.
Bye-bye.